If you're building your ABA company and you're tired of guessing, this is for you. We built the EBCBA blueprint to give you real structure, systems, and support without the fluffs. Details are in the description. All right, everyone. Today we have Kay Ward of CredAlt. First of all, she has this amazing platform she's built in CredAlt. If you haven't seen the demo on that, go back in the feed, check out that demo. Amazing setup. Kay today, at our request, is sharing her knowledge and expertise in the area of negotiating payer contracts, squeezing a little bit more out of a payer contract is going to make a huge difference in your overall profit. This is the kind of thing that goes straight to the bottom line. And as we all know, profit is necessary. It's what fuels your mission. So one very important way to do that, and we all need to make sure that we're staying on top of this, is negotiating better contracts with your payers. Kay, once again, welcome. It's a huge bonus for our members to get to come on and listen to you, especially attending the live calls. Your videos are some of our most watched videos. So thank you for your time once again. Take it away.
Thank you so much, Derek, for that amazing introduction. As always, I'm excited to be here with you guys today to discuss something that's extremely critical to the success of your ABA practice. My name is Kay, as Derek already introduced me, and I am the co-founder of CredAlt. I've dedicated my career pretty much helping providers just like you guys navigate the complex world of payer credentialing, payer relations, and building those relationships. I first started working with ABA practices about 15 years ago, and I was super shocked by how many clinicians were struggling financially simply because they didn't know how to effectively negotiate with payers. So that experience really stayed with me, and it's actually what drove me to create the resources I'm sharing here with you guys today. So about a little bit about me before we hop in. I've spent over 15 years in the trenches of healthcare credentialing, provider enrollment, and contract negotiation. I've learned during this journey, ultimately, which led me to co-found CredAlt. My passion really stems from seeing many clinicians struggling because they lack the tools and knowledge to advocate effectively for themselves with payers. And I firmly believe that when providers have the right data and strategies, they can transform these relationships and their practice outcomes. And that's just not good for you. It's good for your clients, your patients, and ultimately for payers themselves as well. So today, I'll walk you through a comprehensive approach to payer contract negotiation. We're going to start with the essential preparations you need to make before any conversation begins, because preparation is going to be 80% of successful payer negotiation. We'll then explore some specific negotiation strategies that ultimately get you results. You'll also learn which contract terms deserve your closest attention and how to target them effectively. And I'll also help you recognize common pitfalls that derail many practices. I've witnessed so many negotiation mistakes over the years, and I want you guys to be able to benefit from those lessons without having to learn them the hard way, like many others have. So by the end of our session, you'll have developed your own roadmap for success. And there's no one-size-fits-all approach here. Every practice has their own unique strengths and their challenges, and your negotiation strategy would definitely need to reflect that. So why does payer contract negotiation even matter? Like, why do you care about this? Why are we spending our time talking about these contracts today? So first and foremost, these contracts directly impact your financial stability. They determine your revenue streams and ultimately what makes your practice viable. So structured agreements significantly reduce your administrative burden too. So you want to think about it like this. So how much of your team is spending with claim denials, authorization issues, maybe payment disputes? A lot of the headache comes from poorly negotiated contract terms. So when you clean those up and you start to free yourself and your team to focus on what you really care about, which is serving patients. These negotiations also help establish the foundation for long-term relationship build with payers. They're a permanent part of the healthcare landscape. So learning how to work effectively with them is extremely important. It's essential for long-term practice sustainability. These contracts provide essential legal protection for your practice as well. I've seen situations where language have left many providers vulnerable. And that kind of financial hit can be devastating for most practices, especially smaller practices. When ABA practices start, there's usually one provider, one contract, a few contracts, and that practice just starts to flourish from there. And then most importantly, these negotiations will help you deliver quality service to the patients that need you the most, because at the end of the day, that's truly what it's all about, is patient care. And when your practice is financially healthy and administratively efficient, you can focus on providing the best care possible. So that's pretty much the why behind today's topic. And negotiations aren't just paperwork. They're there's That's what's key to growth of many successful ABA practices. So, knowing your value, you are the voice for your practice. No one else will advocate for your practice's worth except you. No one will. So, payers are focused on their bottom line, and that's their job. And your job is to focus on your bottom line. So, it's your job to help them understand why investing in your services benefits everyone for them and including their members as well. So, when you enter these negotiation terms, you want to have confidence. And it's not about being confrontational. It's just about being a clear business professional who knows exactly what they bring to the table. So that brings us to our data slides. Effective negotiations are going to begin with preparation. I cannot stress that enough. Being prepared is absolutely critical to how your practice will end up. So let's start first by what's extremely important. So, what type of qualifications do your staff have? Is there any specialized expertise? What type of certifications do they hold? Have they completed any type of training? What unique skills do they bring to the table? And also for your practice. These are credentials that help differentiate your practice and justify those premium rate increases that you ultimately want. And then next is something that I see a lot of practices leave out, which is understanding your current patient load and your ability to take on new clients. So a little bit about what we've been seeing in the latest credentialing applications and required information is going to be panel size. What does your capability look like to take on those clients? And if you're a practice that already at capacity, you already have a wait list, then that's valuable information that demonstrates the market demand for your services in that area. So if you have capacity for new patients, you can position yourself as a solution to payers' network adequacy requirements. So that's those network closure letters where you're getting them and they're like, hey, we no longer have a need for you in our network. That's your advantage to be able to fight for yourself and fight for your practice. And then lastly, the most crucial part is calculating your true service delivery cost. And when I say the true cost, I mean everything. Providers significantly underestimate these figures and often that leaves them vulnerable in negotiations. So you want to calculate everything from clinical time to administrative support, facility expenses, technology investments. If you got a new EHR platform, you want to have all those costs and more to be able to effectively negotiate your contract. So you want to take the time to gather that information comprehensively. And it's not just paperwork, it's definitely the ammunition you're going to need for effective negotiations. And in our next slide, knowing your practice, understanding your market. I see a lot of practice says they go out, they build, and they don't do the research before. So knowing your practice inside and out is only half the equation. You must also thoroughly understand your market environment. What does the community look like? Many providers feel uncomfortable researching their competitors. They worry it may feel illegal to know about other competitors in your area, but it's really not about undermining anyone else. It's about the understanding the landscape you're operating in and being able to make informed business decisions. You want to think of it like if you were opening a restaurant, you want to know what other extra restaurants are in the area. That's going to be one of your first things. What's out there and who do they serve? You're also going to want to know what their price points are and how busy they are. The same principles apply to your ABA practice. It's basic business knowledge that any practice owner should gather. So not doing your research just puts you in a extreme disadvantage when it comes to contract negotiation. Our next slide is going to be our financial metrics slide. So numbers really tell an incredible story in negotiations. I've seen practices completely transform their payer relationships simply by walking in with the right financial data that's organized effectively. There once was this practice I worked with in Texas. They've been trying to get for years to get better rates with their largest payer. They kept emphasizing things like quality care, passion, expertise. They were all important things, actually, but it just wasn't getting the payer to move on anything. So emotional appeals rarely move payers. They may sympathize with you at the beginning, but ultimately it's what helps their bottom line. So you really want to be strategic about that. And then analyzing your payer patterns. You want to begin by identifying your most frequently billed service codes. So you want to take your top 5 codes and you want to dump them into a spreadsheet for simple purposes. For most ABA practices, this may include things like assessment codes, direct treatment codes, supervision, maybe even parent training codes. These are the codes that's going to represent your practice's core revenue streams, and they deserve that particular attention during those negotiations. It's easy to get caught up in trying to negotiate every single code in your contract. So you get that fee schedule from the payer and you search and looking for the codes that you bill. You just want to take your top 5. You want to calculate your average reimbursement rates across all payers for those critical codes. So if you take commercial only, if you take Medicaid only, or if you're well versed in all, that analyst is often going to reveal surprising disparities that can become fuel for negotiation. So here's a tip. So the first thing you want to do is create that simple spreadsheet with your 5 to 10 codes. Next, you want to fill in the reimbursement rates for each code and each pair combined. You can color code the cells that are significantly below average. So those are going to be where you want to start when you have that contract already and it's hurting your practice. Any payer that is offering the lowest amount, that's where you want to start first. And then you also want to look at patterns in payer behavior beyond the rates. So are they paying on time? Are they denying some specific codes? Are they requiring more admin work to get clean claims processed? So these insights will help you prioritize which issues to address with each payer. For instance, a lower rate from a payer who pays promptly with minimal denials might actually be better for your cash flow than a higher rate from a payer who routinely denies claims and takes more than 60 days to pay. And we all know some of those payers that do that. Understanding those patterns, though, helps you focus your negotiation efforts where they'll have the biggest impact on your overall financial health. And so let's talk about setting and establishing negotiation parameters. There's this myth in negotiation that you should start by asking for extremely high rates, 30-40% over the normal rates. But in my experience, that approach often backfires. Starting extremely high and expecting unrealistic rates often marks you as uninformed in your market or unreasonable, and it can actually shut down productive dialogue before it even begins. So negotiation strategy and rate discussions. I think there is a pretty much a fundamental mindset shift that has to happen. So many providers approach payer negotiations with a negative mindset and it's you versus them or something like that. And I totally understand why that happens because you've had negative experiences in the past. They've paid low, they don't communicate well. But in my experience, effective negotiation is as much about relationship building as it is about those specific terms. When you shift to being a partner with the payer, the entire dynamic changes. I encourage you to enter those conversations with payers as potential partners in delivering quality care. This mindset just opens doors to more productive discussions while allowing you to allocate firmly for what you need in your practice. And ultimately, it's going to be rate increases. But however, some of those terms that we're going to get into in a few slides later are also things that you want to be able to watch out for. So, rate discussions. This is often a challenge for many providers. First and foremost, you want to let your data drive the conversation. So, if you have no data, you have no fuel. You want to present your case with justifications based on all the prep work we just discussed and not any emotional appeals. So, I need to get paid better. You may say things like, I need to be paid better. I can't afford to pay my BCBAs. I can't afford to pay my RBTs. And I've sat in on countless rate negotiations, and quotes like that don't work. So, what actually works though? Specific statements like, and you would also have to already have this data prepared. So, things like our direct cost, service costs include therapists, RBT compensation, benefits, training, and supervision, and the average of what that is per hour versus our current rate of X creates a margin of only blank, which means it's below industry standards. And those blanks and those X and Y's that I mentioned, it's for things for you to plug in that you already have the data on in your practice. That's for you to plug in and start those conversations. The next thing you want to demonstrate is how does your practice maintain quality while keeping cost low? That's extremely important for payers. They want to know that you deliver high care at a low cost and being able to show that. So you want to be able to share your outcome metrics. How long did your patients stay in therapy? How many appointments did they miss? These are the things that you want to be able to keep track of. And these are quality indicators that differentiate your services. So if you can show that your services lead to faster goal achievement or longer lasting results, then that's going to be one of the most valuable things in your negotiations. So for most ABA practices, direct treatment hours are going to be your bread and butter. Maybe that's not the same for everything, for every ABA practice, but it is likely for most of them. So securing appropriate rates for those codes should be one of your primary focus if that is an area that you primarily focus on. But you also don't want to neglect those supervision and assessment codes, which are often undervalued. And lastly, you just want to clearly articulate how appropriate rates directly impact your ability to be able to maintain service, quality, and accessibility. You want to help payers understand that fair reimbursement for you ultimately benefits their members as well. So you just want to make sure that the payer clearly understands that you're delivering high quality care and you can sustain your practice long term. You want to insist on crystal clear fee schedules that specify exactly what you'll be paid for each service code. And sometimes these fee schedules are included in the contracts, but sometimes you have to go out and get them. And you can start with a resource, Availity. If you're already in practice, Availity is a resource where if you were not issued your fee schedule at the time of contract, you can go on to Availity or any of the payers portals, and you should be able to locate that information. Sometimes it's hidden because payers like to keep things competitive, but that information will definitely be given to you if you request it. And another last thing, you want to be able to push for reasonable clean claim definitions that protect you from denial. So the definition of a clean claim in your contract should be specific and attainable. You want to secure appeal rights with reasonable timeframes for resolution. A strong appeals process protects you if any disagreements were to arise. Awesome. So that brings us into our next slide. And this slide is about just critical payment terms to target when you're looking at your contracts. You want to make sure that the fee schedules are there, the timely payment requirements are there. So how long does a payer have to pay you if the claim is clean? The claim is clean, yes. And then you want to have those definitions there. You also want to, if there is any opportunity to retroactive any claims, you want to make sure that verbiage is listed in your contract. And any appeal rights and resolution timeframes, you want to make sure those things are clearly there as well. So now let's talk about broadening our focus beyond payment. A little bit about what I discussed earlier of, yes, I want increases. Yes, my practice is viable enough for an increase, but we want to broaden our focus beyond payments. I just touched on this a little bit in the previous slide, but we want to remember that favorable terms in these areas can sometimes be more valuable than those rate increases. Is a payer paying quickly? Are they not? Have claims been sitting 180 days idle and you have backlog and everything? So each element will discuss impacts in your daily operations and long-term practice sustainability. Approaching those strategically creates basically a contract that works for you rather than against you, which if you're initially signing a lot of those contracts, most payers will tell you to just sign it and we don't offer, but you also want to just make sure you're fighting for yourself, your livelihood, and the viability of your practice. So see, these are some of the terms to know in your contract. So knowing this contract terminology before those negotiations begin is critical. You want to make sure you're understanding the provisions related to ineligible members, which helps protect you from delivering care that will not be reimbursed and it won't ever be reimbursed. So knowing the timely filing provisions inside and out, these are deadlines that can make a difference between payment and write-offs. Claim submission and payment terms establish the rules for the revenue cycle. Remember, if you're not credentialed properly, if you don't have these terms and these things or know these things in your contracts, there is no revenue cycle and the viability of your practice is going to be significantly low if you do not understand all the terms that are listed in your contracts. And also, member billing provisions determine when and how you can bill patients directly. Network participation requirements outline your obligations as an in-network provider. You want to pay close attention to all 7 of these sections. And there's other sections that you need to pay attention to as well, but these are going to be the most critical. So mastering this terminology gives you confidence. It will give you confidence during discussions. And it'll also help you identify any problematic language before you even sign any of those payer contracts. Sorry, guys, just had to take a sip of water. So, but beyond knowing those standard terms, if you want to focus significantly on negotiating specific provisions that protect your practice, you want to be able to push for reasonable authorization durations. You want to clarify exactly what documentation is required for successful claims. And you can start with your provider service representatives. If you call your payer, you hit option 1, talk to the billing. They should be able to tell you exactly what is required for successful claims outside of what's already outlined in your contracts. So establishing clear timelines for authorizations, those decisions allow you to plan patient care effectively. So getting those pre-auths, things like that helps you deliver strong care to your patients and also prevents any surprise bills that the patient may get or may be responsible for. And also negotiating transparent credentialing procedures. So this is going to be a lot for your practices that have 3 to 4 or more providers. That gives you a little bit of leverage to negotiate the credentialing procedures and the timelines within those contracts. One of the next things you want to make sure is outlined is going to be ensuring medical necessity criteria is clear and clinically appropriate for those ABA services that the client is seeking. And finally, you want to clarify contract duration and renewal terms to avoid intentional lapses. So if most contracts are renewed on an annual basis without any outreach to the payer, but you just want to make sure that you're looking at your contracts quarterly. If you've seen a significant increase in patients, you want to make sure you're looking at those quarterly or at least twice a year. And that leads us into one of our next slides. What are the common pitfalls that you would need to prepare for? Well-prepared providers fall into negotiation traps. Learning from others helps you avoid experiencing costly mistakes. So in the next few slides, we'll examine the most common pitfalls and how to prevent those. So how to prevent those mistakes. So first, never enter negotiations without a thorough understanding of your true cost. You need to know your cost down to the T. I've seen practices accept rates that actually lost them money on every service hour because they hadn't calculated their expenses accurately. How do you know what to ask the payer for if you don't even know what it's costing you? So you just want to make sure you're really in there and know exactly what it's costing you to serve every patient, pay every employee that you have. Inadequate market research leaves you vulnerable to accepting ridiculous terms simply because you don't know what's possible. And what we mean by that is you need to be able to do research within your communities, market research using sources like the BACB, how helpful that may be, looking at publicly posted rates. So from Medicaid publicly post their rates. You can compare from a couple of other like TRICARE, they also post those rates. So that's the type of market research you want to do to understand what you should be paid. And then finally, insufficient documentation of your practice's value is going to weaken your position. You want to be able to collect and organize evidence of your quality metrics, specialized expertise within your practice, and market position before discussions even begin. And that leads us into our next slide. So you want to be able to avoiding negotiation mistakes, investing time in truly building relationships with your payer representative is going to be important. Understanding their priorities and their constraints is going to help you propose solutions that work for both parties, yourself and for the payer. You want to avoid focusing exclusively on rates. You want to focus on other terms like those credentialing timeframes, timely filing. Those are the things that you want to focus on as well. That's going to help the health of your practice. And also modest rate increases coupled with problematic administrative requirements actually leave you worse off than before. So negotiating poor terms is going to, and I get it, you may be a new practice owner, you're just happy to get exactly what they give you, but always, if you feel like those are low, always give some fight back. Sometimes it's going to be a no or a yes, but that's where it comes into knowing exactly the services you offer, certifications, also level setting and just putting yourself higher than the competition. What can you do in those terms? And so summary for today, you want to remember that thorough preparation lays the groundwork for everything. You want to know your practice inside and out before those payer discussions even begin. You want to be able to clearly articulate your value prop using the specific data points and the market context that you've already gathered. You want to help payers be able to understand exactly why your services deserve appropriate compensation. You want to invest in building and maintaining those relationships with payer representatives. Reach out to them quarterly. See if there's any opportunity for a rate increase. Things open, and it's not up to the payer representative to let any of us know. That's us being on top of our game, making sure that we are having that open door relationship with payers. And those connections facilitate problem solving when those challenges do arise. And just like I stated before, reviewing those contracts more than once a year or whenever it starts to get inconvenient. You just want to always be in the know when it comes to those things, and focusing on the entire contract, balancing those rate considerations with operational terms that you know are affecting your practice. And that's about it. I would like to thank everyone for your time, your attention, and your engagement today. My contact info is on the screen if you decide that you would like to chat, and I would love to open the door for any Q&A.
Awesome. Yeah, Vi has a question. And I also wanted to ask you to zoom in on one specific area, if you don't mind. The
Sure.
the justification for rate increases. What are some good points? Like I'm thinking about what I often am talking about, like building a compliance program, increasing security, developing, we're going to be implementing some research and development, and we're going to need to increase our revenue to do that and provide better services. But like having programs or having a plan of action over the course of 12 months and saying, these are the things that we're going to be doing to implementing to increase our level of service to your policyholders. We're looking for participation with that, right? We need to increase our bottom line in order to cover costs of these items. Is that something that a payer is going to care about? What are the things that you're going to talk about with them that are going to help them say, yes, this is an investment that we need to make in this ABA therapy company to make them a better provider?
Yeah, so that's an amazing question. And I think when negotiation conversations start, when providers are like, okay, I just can't do it anymore. It's not sustainable. So you want to consider you want to start with your staff. You want to consider any type of specializations they have, any certification, any of those things that makes the competition less. What I mean by that is if they have any type of autism certifications that others that are not likely, if your ABA or ABA practice is certified and has any accreditation like the CASB, those are things that are going to fuel if you offer weekend hours, which a lot of practices don't. So if there is someone that's even available via telehealth in your practice, those are things that payers love, language speaking. So if you see a certain set of patients and there's a language barrier, having accessibility to an interpreter is going to be things. And I'm pretty sure there may be companies out there now that you can just pay per hour or something for an interpreter. But these are things that payers are wanting to know more. And these are the type of people that are thinking outside of the box. What are you doing differently? If you're just the 8 to 5 practice, that may not be enough first. And they already don't want to pay enough. So it's okay. What can I do to make myself think outside of the box? I think those are some of the critically things that are definitely at the top of my list and things that I've used to actually get some of those fee negotiations approved.
That's good advice. Is there anything that we should stay away from? I know there's antitrust laws and things like that with price fixing, but is it dangerous to communicate with other ABA providers where they have the same payer and collaborate on this, or is that a no-no?
I think don't ask, don't tell, but generally speaking, payers like to keep their pricing competitive. And what I'm seeing a lot is I recently had to sign an NDA with a payer because we were still facilitating the credentialing process on behalf of the provider. So we were asked to sign an NDA to not disclose or discuss rates. And I see a lot more payers are starting to do that. This one was a national payer. So I think that may be something to keep things super competitive. Definitely don't ask, don't tell, but I do see that becoming a thing for the future. And I would think that payers, of course, would like to remain competitive, but also if you're denying providers to not be in the network, then there's another thing. But yeah, that's pretty much my take on that one.
Yeah, and understanding your environment. And like you said, if they're denying providers because they already have too many or whatever, it might be not the greatest time to negotiate for a higher pay rate if they have a line of providers out the door. So Vi had a question, but I wanted to address this also. If you guys haven't taken our free foundation course on the EBCBA Odyssey, definitely register for that and take that course. And this circles back to what Vi is asking here. Josh will drop the link for that in the chat. But in that foundation course, we take you step by step. If you have nothing, purchasing your domain, setting up your AWS account, setting up a free Microsoft trial for 30 days. And if you already have that stuff taken care of, continuing on and building your infrastructure. But one of the things that we do in the second module before we start getting into your business development is helping you build a safe and showing you how to use it safely, but a setup with, we call it the Executive Assistant GPT on OpenAI. And this is something that leads into what Vi is talking about. If you need a tool to help you build this kind of communication with a payer or any kind of your SOPs and documentation, that is a powerful tool to load it with all the details and say, help me think out a strategy, help me write an email, help me do this kind of thing with that AI tool. But Vi's question, Kay, is do you have a template letter that they can use when renegotiating rates that might be helpful to them?
Yeah, I don't have anything readily available, but I definitely would be able to create something and share with Derek and Josh so that they can post it in the group. And it may be something that you guys can include in your course also to be able to give to the ABA community. Definitely love everything that the ABA community provides. So I would love to be able to produce that resource for you.
You know what, Vi, we'll get with Kay and develop something because we could just build something that kind of says these are the things, these are the talking points you need to make sure that you're including. Just a structure for that conversation would be good, including what you want to open with in a letter or an email or a phone call, something like that. I don't like using scripts or template emails in situations like this because there's so many variables. You just want to make sure that it's basically sales, Vi. Are you
Yes,
with me on that? It's a sales
I
call,
agree.
and it's an important sales call that is going to mean the difference between if you get a 1% increase from a payer, that isn't a 1% increase on right to your bottom line. This is important to make sure that you're addressing this properly, that it's well thought out, that you're practicing a little bit of closing and approaching with the sales. You're doing a sales presentation essentially, and you're bringing them from where they are. You're persuading them to do something that they don't want to do. They don't want to pay you more money. So you want to convince them why it is. And that is 100% sales and negotiation. So we want to make sure that we're approaching that in the proper way. But I think where Kay and her experience can provide some value there for us is this is what payers want to know about. This is what will start to move the needle in that conversation. So we'll work on something in that regard, Vice. But that's a great question. But Kay, thank you once
Amazing
again.
question, Vi.
You're always so much fun to work with, and I always learn so much when you jump on. Again, we have so many great contributors in this community, and what makes our community good and great is our membership. But what makes it beautiful is all of the information that we get from people like Kay. Thank you once again, Kay, for coming in and sharing your expertise. A lot of people are afraid to do this because they think they're going to give away all their knowledge. But the really solid subject matter experts are the ones like Kay that are willing to come up here and put themselves out there in front of almost 10,000 people now. We'll probably be at 10,000 people by the end of the week here, hopefully. So tell your friends, make them join. To really put themselves out there and just freely share what they know. That shows, number one, that Kay, you really have a heart for the industry and that you're committed. And number two, you actually know what you're talking about, girl. So thank you for sharing with us.
Thank you so much, Derek, for those kind words. And as always, I'm honored to be here and give out this education because literally it means nothing. It means nothing for me to get on here and help someone build a sustainable, successful practice. And I love everything that you and Josh are doing to continue to push the ABA community forward. And yeah, I'm definitely looking forward to, I'm always over there in the ABA challenges group. So if you guys ever see me, say hi. And I'm honored, of course, to continue to do these whenever we need to.
And again, if you have not seen Kay's demo with her developer, they came on and it was her co-founder and developer that put together this amazing CredAlt app. Definitely go check out that demo. It's in the pinned videos. So go back through the recordings and watch that because CredAlt is filling a huge gap. And we haven't really even talked about that in this live stream, but definitely an amazing product to go check out and implement at your ABA therapy business. So thank you again, Kay. Everyone, we love you. We'll see you on the ABA Business Challenges and our new exclusive Odyssey community launching May 1st. So definitely go check out the EBCBA www.abaimpact.com and get that free foundation course done. It'll really help push you forward.
Amazing. Thanks so much, guys. Have a good one.
Thank you, Kay.
Bye-bye.
You're already doing the work, investing your time, your energy, and your vision. So let's make it count. Build something that works without breaking you. The EBCBA Blueprint is the way. Get started for free with our foundation course.